Hello, everyone. My name is Dr. Ahmed Kamara. I am a general practitioner, GP in the UK, and clinical director of Doctor2U. I'm still an NHS practicing GP. I've been a doctor since 2005, and over that period of time, I've acquired tremendous amounts of hospital experience. And this is my way of sharing with you some tools about various medical topics so that you can become master of your own health. It is, however, really important that you seek expert medical advice about your particular circumstances, your particular health condition, so that you can get the most optimal management advice for your situation. What I want to talk to you about today is a very topical subject, COVID-19. COVID-19 is caused by a family of viruses called coronavirus, and a particular strain called SARS-CoV-2 is actually what's responsible for the development of COVID-19. WHO became aware of this particular virus towards the end of 2019, in December actually, after an outbreak of viral pneumonia in Wuhan City in China. The interesting thing about coronaviruses is they've been around for many years, and they typically cause respiratory symptoms such as flu-like illnesses, and the severity of which can vary. Viruses are very small, smaller than bacteria, and without our cells, without human cells, they cannot actually survive. They need our cells in order to be able to replicate and divide. So, as devastating as COVID-19 has been, if it wasn't for our cells, then the outbreak would be over. Now, since WHO learned about the initial cases of viral pneumonia in Wuhan City back in December 2019, as we all know, there has been widespread cases of COVID-19 that has developed in various countries around the world. As I speak, there have currently been over 54,300,000 confirmed cases of COVID-19, with over 1,300,000 deaths confirmed worldwide. In the United Kingdom alone, there have been over 1,300,000 cases confirmed as I speak today, and there have been over 50,000 confirmed deaths. It has affected so many countries. In fact, over 220 countries or areas have been affected around the world. It has been absolutely devastating, and it's had widespread impact on our social lives, our economic lives, to name but a few. Who gets COVID-19? Well, the truth is, we're all at risk. We're all potentially vulnerable to this virus. What we've learned, however, is that the most at-risk groups are patients over the age of 60 years old, and patients with underlying chronic illnesses such as asthma, diabetes, chronic obstructive pulmonary disease, otherwise known as COPD, underlying heart disease, or chronic kidney disease, to name but a few. If you're also taking an immunosuppressant drug for a particular condition, you are also predisposed, you're also at risk because it dampens down your immune system. And the same is true if you're also taking anti-cancer drugs. However, if you're in doubt, the best thing to do is speak to your clinician, speak to your GP, to get expert advice on this. Now, if you have been infected by, the COVID-19 virus, what are the signs and symptoms of COVID-19? Well, this can be quite vague. A lot of people do not actually have any symptoms, and we tend to refer to patients like this as asymptomatic patients. And that's quite difficult because one, the patient doesn't know that they have COVID-19, and two, clinicians don't know that a patient is asymptomatic unless they're tested. But when you're infected by the virus, if you do go on to develop symptoms, on average, this can take about 5 to 6 days. But the range can be anywhere from a few days up to 14 days. And that's why the quarantine and isolation and guidances are all around the 14 days that we've all been hearing. The most common symptoms, however, when someone does develop symptoms of COVID-19 are a persistent, usually dry cough, persistent high temperature, and fatigue or malaise, or general lethargy in association with this. Some patients might just develop typical flu-like symptoms, muscle aches, sore throat, joint aches, or headaches. What's really, really important is to be aware of the symptoms that usually indicate that you're developing a more severe form of COVID-19. And these include breathlessness, confusion, chest pain or chest heaviness, or persistent high temperature despite taking, paracetamol or other medications to lower your temperature. Again, if you think you may have coronavirus, if you've been exposed to anyone with the virus, the most important thing to do is to seek expert medical advice regarding your personal circumstance. Well, how do we diagnose COVID-19? Wherever possible, if you have symptoms suggestive of COVID-19, such as the ones mentioned above, you should go on and have a test. The test will determine whether or not you need to self-isolate for 14 days, and whether there needs to be any contact tracing, and in particular whether those people who may have come into contact with you recently need to be quarantined as well. What are the tests available? Well, there are two tests on the market that currently tells us whether or not you have coronavirus, broadly speaking. So you have what we call the rapid antigen test, and these tests look for specific antigen of the SARS-CoV-2 virus that causes COVID-19. What is an antigen? An antigen is basically a specific component on the virus that is identifiable as belonging solely to the SARS-CoV-2 virus that causes COVID-19. So throat swabs or nasal swabs are taken, and if these antigens are identified in those swabs, we can be pretty certain that the presence of SARS-CoV-2 is within those samples that have been taken, and therefore confirming that you have COVID-19. These tests are rapid. They can usually be turned around within several hours and certainly within the same day. The downside to this test is they're not so accurate. They can actually sometimes give misdiagnoses, and that is an issue with them. There is one other test which is a lot more accurate. It's called the polymerase chain reaction test, the PCR test, and this actually looks for specific SARS-CoV-2 RNA, ribonucleic acid, and this is the genetic material that is within the virus. So it can actually, in a very clever way, pick up very, very small amounts of this genetic material, the RNA, and amplify it to a point where it can be detected as belonging to the SARS-CoV-2 virus. This is a highly, highly specific test. It, however, takes a couple of days to turn around, which is sometimes a downside to it, because you want the test results available as soon as possible. You may have also heard about the antibody test. The antibody test doesn't tell us whether you have COVID-19 presently. It only tells us whether you've had a past infection of COVID-19. Antibodies are usually produced in response to an active infection, and the particular antigen that is tested for is called an IgG. And once produced, it usually remains present in our bodies for a long period of time, so that if we're exposed to the virus at some point in the future, we have antibodies that can come into action and fight the virus and stop us from getting a serious infection. What isn't clear at the moment is we're not sure how long the antibody against the SARS-CoV-2 actually persists within our body, and therefore we're not sure whether, if you've had COVID-19, whether that offers you protection in the long term from future infections. Now, let's say someone has been confirmed as having, COVID-19. Well, how do we treat that person, or what treatments can you take? And this is really important to know. The vast majority of patients don't actually need any treatment because most people develop very, very mild symptoms. But what's really, really important here is to know is that there isn't any curative treatment for coronavirus. There isn't any medication that gets rid of the virus at the moment, at the time of making this video. So a very, very important part of the treatment is actually prevention. Okay, hence why it's really, really important to follow all of those measures that we've been hearing about, hand washing, social distancing, self-isolation if you have symptoms, wearing a mask if you can't social distance adequately, ensuring that you have good ventilation in your room, following all your local public health and government advices. Now, another element of treating coronavirus also in patients who have been confirmed to have the disease but who do not have any severe symptoms is the isolation that I mentioned earlier. Now, if you isolate yourself for about 14 days and you don't have any significant symptoms during that time, you're usually fine, and you're usually fine to interact with other people again. Now, some of you may have also heard of the term quarantine. Quarantining people is not for people who have had coronavirus. Okay, it's for people who have been exposed or may have potentially been exposed to others with coronavirus. But the principle is the same. You're normally advised to quarantine yourself for 14 days if you find yourself in that category. Now, what about patients, who go on to develop the severe symptoms, the breathlessness, chest pain, chest heaviness? What are the treatments available for these patients? Now, first thing to say is it's really important that if you're developing any of these severe symptoms, you seek medical advice. You may need to go to your local emergency department. You will need to follow whatever the local advice is where you live. When you do get to hospital, these patients are normally given what we call supportive management. Again, as I mentioned, there isn't any actual curative treatment or drug for coronavirus. So the aim is to support your various organs and allow your body to fight the virus itself. Now, what might be given? You might be given oxygen therapy. Okay, you might be given fluid, so to rehydrate you. Now, some patients who go on to develop more severe breathlessness and need intensive care and ventilatory support may be given a medication called dexamethasone, which is a very powerful steroid. This is not something that you should be buying yourself or over the internet or over the counter and self-medicating. You should not be self-medicating yourself at any point at all if you think you have, coronavirus. Now, there are also other treatments that may be given, but they are as a result of additional complications that may happen in patients with severe symptoms of COVID-19. And this, for example, might be antibiotics. Now, antibiotics do not treat viruses, they treat bacteria. So antibiotics are given to patients who develop a secondary bacterial pneumonia on top of the COVID-19 disease that they may have developed. You may also be given medications that help to break blood clots, because one of the things that we found is some patients develop something called pulmonary embolism when they develop the COVID-19 in hospital. But again, you shouldn't be buying medications or taking antibiotics without medical advice. You shouldn't be buying medications to thin your blood. It's quite dangerous, actually. This should only be done with correct medical intervention and supervision. And finally, I think I probably ought to say something about, hydroxychloroquine and chloroquine. Now, hydroxychloroquine is used to treat certain immune conditions such as lupus or SLE, systemic lupus erythematosus. And chloroquine is used to treat malaria in many parts around the world. They're sort of part of the same family. All the research that's been done at the moment have shown that there isn't actually any efficacy. So there isn't any data that's shown that these medications are effective at treating COVID-19. So you shouldn't be buying these medications off the internet or asking your GP or physician for these medications because you want to treat yourself for possible COVID-19. Now, what is really important to know in any medical illness is its prognosis. So let's say you've developed COVID-19 or someone has, what's likely to happen to these people down the line. Well, the good thing to first of all just reiterate here is that 80% of people recover without needing hospitalization at all. Only about 15% develop serious illness that needs hospitalization, and 5% develop critical illness. So that's the severe respiratory deterioration that we call ARDS, acute respiratory distress syndrome. Now, for something that is still quite short in our history, again, this has only been going on since November, December 2019, it is difficult to know with certainty what the long-term effects are. However, what's coming up is that, look, majority of patients recover without any long-term effects. But there is something emerging, something called long COVID syndrome, which some patients are developing, and there's still a lot of research going on about this. And these are sort of chronic symptoms of fatigue or breathlessness, and other sort of neurological symptoms as well, maybe pins and needles or weakness generally, which need greater research and further understanding. We've also seen that some patients who develop loss of taste or smell can carry on developing these symptoms, or can carry on having these symptoms for many months down the line. So there is still a lot being learned about what the long-term prognosis or long-term effects of COVID-19 are. Having not to forget that also the additional long-term psychological impact of any serious illness or on any particular individual and on their loved ones. Okay, so there are wide-ranging effects, not just on the person who's developed it, but also on their loved ones, on their immediate society. Now, what I want to give you, as I mentioned at the very beginning, are tools that can help you be master of your own health. Okay, and so at the end, what I want to talk about are some self-help tools that you can use to prevent yourself from developing coronavirus, and if you do, get appropriate treatment early or look after yourself in the best possible way. Now, before I mention them, I think there are some myths that we just need to raise and highlight and look and say, look, don't believe any of these at all. So you may have heard some of these. This is not an exhaustive list. So 5G doesn't cause coronavirus. Using bleach doesn't cure your coronavirus, but may cause serious life-threatening conditions in you. Using garlic doesn't cure coronavirus. Eating, drinking hot pepper soup doesn't cure your coronavirus. What's really, really important, here is that you follow the local health and public health and government advices of hand washing, social distancing, wearing a face mask, especially in public places where it's not possible to adequately social distance, and self-isolation if you have symptoms or have been confirmed to have coronavirus that isn't serious, and quarantining, following all of these rules. Now, of course, if you've actually developed coronavirus and confirmed to have it, and you're developing a more serious symptoms such as breathlessness, chest pain, chest heaviness, it is really important that you seek medical advice early, as you may need hospitalization, you may need supportive management in the form of oxygen, fluid, or sometimes even in serious cases, ventilation. The earlier you present to hospital, the earlier you seek medical advice, the better the outcome is likely to be with these management advices. So, my friends, that is all I have for you today. Please make sure you seek expert medical advice for your particular circumstance. If you want to reach out to a doctor to you, you can do so by going on our website at www.drtoyou.co.uk. That's www.drtoyou.co.uk, or follow the contact details that are been shown on the screen. Until next time, look after yourselves, stay safe and stay healthy.